Hi, and thank you for watching On Call for All Kids. Today we'll be talking about the common cold. We'll get questions answered about cold symptoms and how to differentiate it from other illnesses, including COVID-19, what remedies help treat colds, and how to prevent the spread of sickness. I am joined by Dr. Joe Perno. He's an emergency medicine physician here at Johns Hopkins All Children's Hospital, and so happy to see you, Dr. Perno.
Hi, Ashley. Thank you for having me.
So, what is the common cold and what causes it?
Yeah, so when people say the common cold, mostly they're referring to viruses that cause inflammation and cold symptoms, which we're all familiar with, of the upper respiratory tract, your nose, your throat, even your upper airways. And typically it's a runny nose, it could be nasal congestion, it could be a cough, and often some of the kids will even experience fever with these symptoms. There's a slew of viruses that can cause these type of symptoms, a little more common in the winter months, so right now going forward, but people suffer from colds all year round. Probably one of the most important things to mention with a common cold is that it is caused by viruses, so it's not impacted by antibiotics. Many times parents will ask pediatricians, can I have an antibiotic to fix the cold? And they just don't work and potentially can cause harm, as you can develop a resistance to the antibiotic. So when you actually need the antibiotic, it won't work for you again. So they're viruses. We have to ride them out. We have to try to prevent them and just try to support the child through the illness.
What are some of those good remedies that we can use as parents as they just get through the course of the virus that they're dealing with?
That's a great question. I actually have to say there's probably no good remedies, but there are some things they could try. It's very challenging. In young children, we know the cough and cold medicines that are advertised just don't work and actually are not recommended. So we try to urge parents under the age of 8 not to use any of the cough and cold medicines they see either advertised on TV or sold in local pharmacies. We really just have to go to the basics. So for the young children, suctioning out their nose, getting that mucus out of there will go a long way to stop cough. It'll help with the child's ability to breathe and take feeds, especially in the little babies. So clearing out their passages. As the child gets older, getting them to blow their nose, clear out some of that mucus is also very helpful. It's very important when kids have colds that they're continuing to take plenty of fluids, staying hydrated. Many times when kids are sick, similar to adults, you don't want to eat a big meal, but at least if they're taking in their fluids, the sport drinks, the water, staying hydrated, that's important. If cough is a big issue, you can try honey is a nice homemade remedy. If the child's over 1 year, we never want to use it in young children, but it's been proven and actually studied to be a pretty decent cough suppressant. So if cough's a bigger problem in older kids, we could try that. And then if children are over the age of 8, you can try cough and cold medicines available over the counter. I'm a big fan of try it. If it helps, great. If not, don't use it. Or you're going to end up just getting the side effects if you're not getting any benefit for it. So no good remedies, but a lot of simple things you could do at home. A humidifier also can help where the child's sleeping. Try to keep everything a little bit moist.
Now, how can we tell the difference between the common cold or maybe, let's say, a sinus infection, and then here we are in the middle of a global pandemic and we're also dealing with COVID-19?
Yeah, so now you're asking the tough questions. So let's start with sinus infection. So most colds last 5 to 7 days. Usually by the week, they're wrapping up. The kids are doing better. Sinus infections, typically we don't diagnose until it's been 10 days of symptoms. And typically we're looking for that persistent of the cold symptoms with things like fever. And if the child's old enough, headache, facial pain, sinus type pain. Sometimes there's a change in the color of the mucus, but that's very variable and I wouldn't rely on that. But if the symptoms are persisting, it's definitely worth being seen by your pediatrician, as there could be a secondary bacterial infection that needs to be addressed. More challenging is differentiating the common cold from COVID, what we're dealing with, and other wintertime viruses. So it's important to know if you're worried about COVID to think, does my child have any exposures, whether it's in your home, whether it's at school or daycare? That would obviously raise the risk factors there. Fever can help, but it could be present in both. It could be not present in either. It's very challenging there. So if you have any concerns that your child may be suffering and there's been an exposure, seeing your pediatrician, having the child tested. We're not recommending testing for asymptomatic, but if your child has symptoms of a cold, which really can mirror the symptoms of COVID, you should consider getting tested. And your pediatrician or the ER may test you for other wintertime viruses, such as RSV or flu, which are also common this season.
Well, lastly, let's talk about how we can prevent the spread of any illness. Now, right now, being in this pandemic, we're oftentimes wearing masks, doing that social and physical distancing. Do you think that this might help prevent some of the flu and the cold that's going around? And just what other ways? Remind us of how we can be safe this fall and winter.
Yeah, that's a great question. And absolutely, it should help. The things that we're doing right now are the same things that we've preached every cold and flu season, right? It's getting the kids to wash their hands more frequently, right? Cough into your elbow or your nose. Now we've had the introduction of wearing masks, which should protect you and your neighbors and friends that you're around. So it's all these measures, social distancing, important to quarantine if your child does get symptoms, whether you believe it's COVID or a regular cold, keeping them quarantined is an important thing because you're protecting not only your child, but you're protecting others. So yeah, theoretically, all these measures that we're doing with COVID in mind should impact all of the viruses. And hopefully all these measures that we're taking will diminish not only cold and flu season, but obviously protect us from a greater surge in COVID. We're in uncharted territory. We don't know where it's going. But again, these are the same measures we preach every year, and it's important for us to continue them both because of pandemic and because of routine cold and flu season.
Well, Dr. Perno, thank you so much for joining us. It's certainly been a long year dealing with this pandemic. I can't believe we're already heading into cold and flu season. So we appreciate all of your advice and information to keep us safe.
Thank you very much.
And thank you all so much for watching. Don't forget, you can check out our website. It's hopkinsallchildrens.org/newsroom, and you'll find a lot of other great resources and pediatric healthcare information there as well. We'll see you next week.